and then chapter 18, but pharmacy techs know that we should do 18 first and then 21. So I'm just gonna swap it around a little bit. I'm gonna teach both, but we're just swapping the order. So without further ado, our pharmacy chapter is in Avetra 14, 29, 5, Bravo, chapter 18, and that's pharmacy. Just as you got noticed, PowerPoints are very wordy, so I'm gonna go straight to the point of what we need to know for pharmacy. It's not like I'm skipping, I don't want you to have the information, but let's just go straight to the point. I don't want you to fall asleep after lunch, and it's a little lengthy. Alright, so just basic terms, pharmacology is basically like the main definition for pharmacy. Some important topics from here is understanding what pharmacodynamics is basically the actions of the medications in the body, and the pharmacotherapeutics is basically like the study of how the medication treatment works. This is what we call our Bible. This is the Remington. This is just a reference. I've never seen a question like this on the test, but this is a good reference for us. Everything that relates to pharmacy, when we have questions, we go to this. That's what we call it, the Blue Bible of Pharmacy.
Is that for like the civilian world too?
Yes, that is correct. All right, so over here, very important terms. Some of them are self-explanatory. You see the word minimum, which is basically the lowest amount of med that we can give somebody in order to produce the desired effect. Maximum dose, obviously, you know how much time you need to give a patient before it makes it toxic. Just be careful with that. The toxic dose is when you went over actually the maximum dose, and you're gonna see symptoms of poisoning. So just be careful with that when you're seeing patients. Therapeutic dose is based on normal dosing, so that's just enough to get the desired effect, like to lower fever, how much time will you give, how much more for pain, and that kind of stuff. Is that why the definition of title? And minimal lethal dose is the least amount of drugs that can cause somebody to die. This is just a little word game fun, so I'm gonna skip through it. So, all right, this is always on the test. So there's two formulas that you're gonna see on the test. There's only one question on the test, but you guys want to get familiarized with that in case you have to do any kind of dose-based calculations. So for age, it's always gonna be attached to Young's rule. So it's gonna be the age in years divided by the age in year plus 12 times the adult dose. That will calculate the child's dose for medication. So there's two of them, so make sure when you get the information on the question, you actually know exactly what you're looking for. And after this is gonna be a question that's gonna be similar to something that you may see on the test. So if you get a question like this, they give you the adult dose, so you will use the equation in order to calculate that. So make sure that you are looking into that, because they give you the dosing and the age. That's the key factor. You're gonna be using Young's rule. So if you get the age, this is the ones that we're using. Now, Clark's rule is a little bit different. They look similar, in terms of what we use to calculate, but that's why this one, when it comes to Clark, we always match it with weight. So in this particular equation, I see them both on the test, so be careful, because I normally see a question or two only, but that could throw you off in terms of how to do it. So for this one, you have the weight in pounds divided by 150 times the adult dose. In the example, you noted the difference that in terms of having the child's age, they're gonna have their weight. That's how you tell the difference on which one you're gonna be using for testing purposes.
The big one you need to know for the test, I'm telling you right now, is what is the most common factor influencing amount of meds. And just know that's going to be age, right? Not the weight, the age.
All right, just like it was mentioned before, these are the factors that will determine how much med we give. Sex come into place because some females can take a certain amount, males not supposed to take a certain amount of medication. There are races too. There's some races that respond to medication faster than others, so that takes into effect when it comes to those decisions. I never really understood what the occupation has to do with determining, so just bear with me. They have ritual use. If some people decide that they're frequent users of certain drugs, that will affect their tolerance too. So that's something that's a factor into effect. The time of administration too, is something that can be used to determine you shouldn't administer the drug for more than a certain amount. You know, the doctor should be tracking on that, but we look at that at pharmacy in order to understand what's going on. The frequency of meds, there's some meds that you're only supposed to get an example every 3 months, so we take that into consideration as well when it comes to determining whether the person should get a med ahead of time or not. And the mode of administration, you know, if I'm giving you something at IV, it might be fast acting as against giving you a tablet, it's gonna take a little bit longer to take effect. So jumping into the methods of administration, the oral is kind of self-explanatory. These two divided into the sublingual, which is under the tongue, and the buccal, which is basically anything you can put on the cheek, like a lozenge or anything like that. You know, those are the two types of oral medication that you might encounter on the test. The parenteral is the one that's a little more complex because there's a lot of layers to this one. You know, subcutaneous, you can see like insulin and kind of stuff. It's fairly common when people work over here, especially in the ER or in the wards. You're gonna see a lot of people getting insulin. So that's a category that it goes into. You know, we have the intradermal. Obviously, that's just go into like their skin. That's listed twice.
What's the only thing we really give intradermally? TB.
Then you obviously have the intramusculars, which is normally your IMs, the intravenous, that was the IVs. I'm an inpatient pharmacy tech, so this is what I do for the team. And then the intrathecal is basically, or intraspinal, it's just anything that's gonna go in the spinal column.
It's like epidurals.
Yes. So going into inhalations, there are 3 different categories for inhalation. You know, it has the vaporization, so it's anything that's gonna be in a form of liquid or solid to gas. You know, that's one of the medications. You don't really see it very common use. You know, there's certain medications that do it, but you don't see it as often for us to use it in the pharmacy. Gas inhalation, you normally don't get it from pharmacy. That's normally that you will see on the wards. You know, because we don't keep any of that. We deal with it, but we don't necessarily keep them in the pharmacy. And the nebulizers, you know, most common like the little droplets for albuterol, stuff like that. That's what comes into that part of inhalation. The topicals, you know, anything that goes on their skin, you know, it's just one of those things that is like, those are kind of self-explanatory. Rectal pad, you know, I'm just going over all the categories that you can encounter for medication. This is very important. You'll see it every time, even those who have to complete the HMPQS. This is one of the questions that always hits everybody that comes through my window to get signed off. You know, make sure you understand the 6 rights, because this is very important, regardless of whether you work in pharmacy or not. As a foreman, you need to understand what these are. You know, 9 times out of 10, okay, you have to write those, right patient, right medication, right time, documentation, and travel. You know, and sometimes I guess something as far off as like right occasion, or like, okay, it's similar to time, but you gotta understand it's the right time. You know, because it might be the right occasion, but not the right time because they already got a drug. So stuff like that, be very careful when you're mentioning out what are the 6 rights. Okay, medication nomenclature. You know, there's 3 different ways we can identify the medications. You know, it has a chemical name. We normally try not to go by those when it comes to pharmacy. We mostly use the generic name, which is like acetaminophen for Tylenol, for example. You know, that's the generic for it. The brand name, everybody uses Tylenol, like everybody's Motrin. It's the same thing as ibuprofen. So the military system goes mostly by generics, but it's also to learn the brand names, because sometimes we can only get brand names like for Centroid. Most of the times we get brand names. So we need to understand that levothyroxine, if you're asking the doctors, hey, what do you need? You know, we need to be able to recognize both. You don't have to memorize anything. You have a pharmacy tech. I don't memorize everything, but I'm able to recognize, or at least look it up. Hey, maybe this is the brand name. There's a little thing on the bottom that can actually tell me the generic, and that's how we determine the medication. Again, medication classes, you know, the estrogen is anything that cause any kind of like shrinkage. The most common one that we use is the Dumbaro powder. So you guys got that kind of stuff going on, you know, that familiar with that. The emollients, you know, it's kind of a more fatty substance, you know, it's very sticky when it comes to that. Then you have the expectorant, which is basically anything that wants you to spit mucus out. So if you want an expectorant, you know, that's why we have our Mucinex DM over here, you know, trusty friend. We dispense that like candy, so come to pharmacy. Antitussive, you know, anything that's gonna help you with your cough, you know, like a Tessalon Pearl, stuff like that. Don't chew on it, it's gonna numb your mouth, so just go ahead and swallow it. Nasal decongestions, you know, the most common ones for us is like for our Sudafed, so don't abuse it, you know, I don't wanna go using Sudafed. And antihistamine, you know, is one of the things for allergies, so the Benadryls are the most common ones that are used, or your Claritin, you prefer Claritin. So you have the antagonist, which is basically, most everybody has acid reflux like myself, so we're very friendly, we're probably sick, you know, but it's not the only category with that, but if it says that you're gonna get an antagonist, no, nobody's gonna fight you, it's just something for your belly, you know. And the antacids, this is normally the Tums. Like I said, another word game. For these antiseptics, disinfectants, and germicides, this is just like, for example, we have like any kind of like cleaning solution for like the skin, you know, anything that you use to prevent growth of bacteria. Even like it even includes the mouthwash for dental, you know, that's something that kills bacteria, that will fall in that category, even though it's also an oral medication, but you're not supposed to be drinking. And understanding the difference between one. So the antiseptic kills, suppress the growth of organism, the germicide kills the organism, and disinfectant is basically, it's just anything that's used to clean inanimate objects with germicidal interaction. So these are the sulfa drugs. This is basically a lot of people who are allergic to it, you know, allergic to penicillins, they're opting for sulfa drugs. So the most common one is the Bactrim, Abdiceptra. Just understand that if anybody needs any kind of treatment that is allergic to that, the most common ones are gonna go to this. Penicillins is most of our common antibiotics. You know, the penicillin G, everybody that, you know, the fun shot is very thick, so don't get it. And the amoxicillin, you know, most common one, given to everybody, but that's what the category that it falls for. The cephalosporin, you normally see those on a kind of a ER and OR settings. Those are the most common antibiotics that they will normally give to you. You know, I see the Ansep all the time, that's why we're always back ordered on it. So, and the Careflex too is something that you really dispense a lot for penicillin allergies. The tetracyclines is sometimes that we don't use it as often. You know, the doxycycline, we don't dispense it fairly common, but it's also understanding that it's also a type of treatment that we can use in terms of alternatives when it comes to antibiotics.
So I want to say this to y'all, because again, there's a lot of stuff that's missing from here that's probably sometimes even more important. I know you've heard that there's the cephalosporins and tetracyclines have some sort of thing where one's the broad spectrum antibiotic or something like that, or something in that series, and then your medications are more detailed, and that's what's going to be asking you on the test. Is they're going to come up with a prescription, or sorry, they're going to name off symptoms of a patient, and then you're going to have to, off those symptoms, know what medication is being given to that patient, right? So I challenge y'all after this PowerPoint to still go back to chapter 18 in the Coleman Manual. And I said, I know I mentioned this before, but find that one symptom that's different, that stands out, and associate that with that medication so that you're good to go for the test on that.
Another question on the test that I've seen often is just why do you administer as gram-positive when they're allergic to penicillin? So that Bactrim, Cetra, you know, that's most commonly your answer for those kind of questions. Again, this is normally a lot of more breaking down the medications for what classifications do we have. You know, the aminoglycosides is basically inhibiting the protein synthesis, like a gentamicin or neomycin. Is also kind of the falls in the category for antibiotics as well. The macrolides, this we use fairly often as well. You know, that's a ground pulsatile cocci that we kind of treat. The most common one is the Banco and the acethromycin. That goes out of my pharmacy like candy, so you're gonna see that more times, 9 times out of 10, that's the answer to your question when you haven't listed as a gram positive cocci.
They will throw gram-positive and gram-negative on the test for medications, so just know that macrolides is the only one for gram-positive cocci.
Then we have antifungals. You know, those of you who, like myself, may have suffered from Adderall's feet at some point in your life. You can get familiar with Pertramazole. You know, this is the best friend during deployments because it's hot, and even if you want it or not, you're probably gonna see it. So, and then my console, I don't see it go out as often, but it's also a choice of treatment. For parasites, the most common one is just that flagyl, the metronidazole. You see it a lot, fairly common all the time. Like I said, learn the generics and the brand, because sometimes they're gonna throw it that has metronidazole and you don't know it's the actual flagyl, and vice versa. Sometimes they can throw the flagyl in there and say, hey, what's going on? So that's why I recommend learning both. You don't have to learn every single medication, but at least the most common one that we use as in the common rate to treat the most common medications. And the anti-malaria, they have over here the Primaquine, but we also use the Malarone, which is a combination with the Primaquine with another medication. So it used to be doxycycline, the dose of choice, but for those who've been deployed in the heat, they're not supposed to be using doxycycline. Laxatives, kind of self-explanatory, you feel backed up, take one of these and it will clear your day. And the diuretics, the most common one for here is the hydrochlorothiazide and the Lasix. They just help you, release the fluids in case you have any kind of fluid retention. This is the non-narcotic analgesics. Like I said, drug of choice, Tylenol and Motrin. Be very careful with these, because 9 times out of 10 they're interchangeable. That doesn't mean that the only thing that you can use for fever is something like Tylenol. You can use Motrin for fever as well. And don't think that it's because there's in a different category that you can't use it interchangeable. So make sure you guys understand that they do one or the other. Same thing with like anti-inflammatories. The Motrin is normally common for reducing inflammation, but that doesn't mean other drugs can't be in that category too. So a lot of drugs will be in different categories that they can fall under.
So to make that make sense too, if you have kids and you've altered between or kept mixing between Tylenol and Motrin, like you do Tylenol for a couple hours and you go to the Motrin and back and forth, it's because of what it's treating, right? One is going to be the antipyretic reducing the fever, and the other one's going to be one that's going to be bringing down the inflammation, right? So you're treating both types of those symptoms with that altering between Tylenol and Motrin.
All right, going into the CNS stimulants, that's basically the central nervous system stimulants. The most common one that we see is the Ritalin. You mostly see that in children. Especially school's about to start, so I'm gonna start dispensing a lot of this. The teachers can get through the day. But you normally see them going out of the pharmacy when it comes to that, and they just basically stimulate the nervous system. That's why they use that. On the other hand, we have the CNS depressants, which is basically the Dilantin is the most common one, or the phenobarbital. Those are the ones you're gonna see a lot when you have, especially patients in the ICU. Sometimes they get that phenobarbital as the CNS depressant because of what they're treating. It can go from mild sedation into a deep coma, so be careful with those, because you don't want to put somebody in a coma because you gave them too much. The opioids, everybody should be familiar with that. It's just basically the primary content is morphine, so that's why morphine is listed there. But your codeines or Demerol, just make sure you guys are tracking that those are all the opioids when it falls into that category. The psychotherapeutic agents, the most that I need you guys to kind of familiarize with is the Valium and the Ambien, because there's always seem to be thrown in the test. And what they do is basically they do mood modifiers. So if you're having trouble sleeping, you can pop Ambien. Some people require 2. But those are the ones that will be best friends if you're having trouble sleeping at night.
So, and that's why it's good to know the meds, because one is going to treat sleeping, one's going to treat anxiety, right? One's going to treat depression, right? Because Ambien is for sleeping, and Valium is for depression, right? If I'm not mistaken.
Mm-hmm.
Yep. So Valium, depression, and then sleeping is going to be that Ambien.
And for us, since we stay very active, the skeletal muscle relaxants, the Baxin and Flexor are your best friends. Then the lady long enough, everything hurts. So this is one of your best friends. So if you don't see Robaxin, you can also see it as methylcarbamol. So I know it's a pretty lengthy word, but you can see it as well. The cardiovascular agents, we see them most likely used on our crash cards. Those who work on the ward, we see that this is part of our crash card components, the amyl nitrate and the nitroglycerin. Those are the kind of stuff that we use normally if we have to respond to a cold blue. 9 times out of 10 is just somebody that just fainted, but sometimes we have to actually put up our crash cards on our bags in order to help.
Where did we use amyl nitrate again? Anybody remember?
For blood agents.
For blood agents, it is your treatment for blood agents. Again, because it's interfering with the oxygen transfer, right? Which is going to be affecting the heart. So it's a cardiovascular agent with amyl nitrate for blood agents.
Then you have your vasoconstrictor, which is the most common one, is normally the epinephrine. So you have an allergic reaction, there's more than likely to use epinephrine in order to combat that. You also have your anticoagulants. Most common one used in the hospital is the heparin. You know, be careful with those. So there's a lot of strengths with heparin that we have to be mindful of. Just understand there's an anticoagulant, and you give somebody too much heparin, and they're having like a wound, they're probably gonna be down. So that's why you stay away from heparin unless you really need it. All right, there's at least one question of this is always on the test. So the best way to memorize is the acronym ADEC. So you have your water soluble or fat soluble vitamins. I would recommend, just going over, and these are the ones that you're probably gonna see one of them on the test. I normally see either the vitamin K or the vitamin A as the retinol. Those are the ones I normally see. That's always a test question, at least the test that I've been taking.
So the asshole thing they like to do on the test, and I'm telling you right now, is for your vitamins, they're not gonna use vitamin A, B, and whatever else. You're gonna be using those names that are right next to it. So your retinol, your tocopherol, and then your B vitamins, they like to throw at least one of those B vitamins on the test to know how to differentiate between 2, 3, 6, and 12 going on there. So I would study the opposite actual scientific names or whatever you would call it for that specific vitamin.
Now understand that only these 4 are the ones that are water and fat soluble, the other ones are not. That's why they're listed on this side and the other instead of 2 different pathways. So for anesthetics, we can have a local anesthetic or general anesthetics. Most common one is the fentanyl one. You can use the ketamine and even the lidocaine. They have cyclocaine and lidocaine listed, but it's basically brand generic. So it's the same drug. So lidocaine you see a lot when it comes like dental procedures and a lot of stuff. They have the good stuff there. So sometimes it lasts too long. But if you work in the maternity ward, the oxytocin, the Pitocin is best friend for a lot of people because it's easier. They say, I never tried oxytocin myself. We try not to start with that. But,
I would hope not.
But, it's one of those things that it's like we do dispense a lot because this hospital has a lot of babies. So, oxytocin is just help with contraction of the uterus.
Just know your lidocaine is your standard anesthetic, too. That's usually a test question.
Moreover, the drug classifications, the elixirs is just basically, your solutions and stuff that you can add into like cough syrup. Some of them are considered elixir because, you can tell by the taste that they are an elixir. Suspensions is just basically the same thing as another formulation of oral medication. 9 times out of 10 we have to reconstitute these, so they come in powder form, and we do have to recon it before because they don't last very long after you recon it. So they last for 10 to 14 days. So that's how you tell the difference between elixir and suspension. Suspension normally is a little thicker and you have to recon it. Ointments, we went over the topicals, just basically a little more thicker than the actual creams. Suppositories, kind of self-explanatory, and then the gelatin gel capsules like Colace and that stuff. Those are the ones who will fall in that category. All right, this is very important because everybody should know that our DD 1289 is our single prescription for pharmacy. So you should only have one drug. If they give you a hard copy, you should only have one drug in there. If you have more than one, more likely not going to get processed, and you gotta go back to your doctor. So understanding the parts of the prescription is very important because now that everything is electronic, if the system goes down, the doctors normally will skip a step. So understanding that you have a complete prescription before you come into my window. So understand that all these steps have to be over there. The patient information has to be filled out. I can't fill anything without having your name on it. It's not gonna happen. The date and the medical treatment facility has to be there as well because certain prescriptions are only good for a certain amount of time. So you need to be very careful when it comes to that. If it's more than 6 months, there's some controls that I cannot fill, and you're probably gonna go without your controls, so be very careful with that. It's always gonna have a valid ARIC sign, so it doesn't have that. We only take the original ones, we do not take copies. So, and it's very easy to tell if you're bringing a copy of something that we already dispensed. So you also have the name of the quantity, and you also need to have the directions, because if not, it's an invalid prescription. And at the end, you need your provider to sign, because if it's not signed, it doesn't make it a valid prescription. This is how it should look like. You know, this is an example of how you should fill it out. So it has all the components that we went over. You know, if any one of these is missing, we can always call the doctor and try to verify it, but that's gonna take probably about 2 hours tops. That's the average time it takes to reach the doctor and then to reach back. So I would recommend getting from us what everything that needs to be in that prescription, but the most important thing of this is that the DD form 1289 is a single prescription. That's normally a test question as well. Alright, now we're going to controlled substances. So there's 5 different controlled substance schedules. So the number 1 is basically anything that we can't use. So LSDs, heroin, you're not gonna find those in my pharmacy. So those are never necessarily in here. Schedule 2s, you know, we do keep those. They're the highest potential of use. So if you need to learn anything from this, is that Schedule 2s are the ones with high potential of use. So if you have a question like that, you know it's a Schedule 2. Remember, the number 1s, we're not supposed to be doing it at all. So that highest abuse potential is Schedule 2s. You know, Schedule 3s, it's just basically, you know, it can develop some kind of dependency to it, but it's not as bad as abusing a Schedule 2. And that's how you go down the line. So start from 2 going down, and then you go into 3, which is basically this medication that helps you sleep. Schedule 4s is just you have limited dependency, so you're more likely to get addicted to your Percocet than you're addicted to your Valium. That's what the point I'm trying to make, because there's 2 Percocet will go under Schedule 2s, while Valium be at Schedule 4. So the lower the number in your schedule, the more likelihood it is for you to be addicted to. So that's the way you see when you look at that. And the Schedule 5 is just basically, you know, antitussive, something like Wafenazine, you know, the cough syrup. Some people can get high with the cough syrup. You gotta drink a lot of it too, but it is there as a category, as a Schedule 5 medication.
Or making meth out of it.
Alright, so that's chapter 18.